Greetings, YouTube. I heard a news piece recently on NPR, and one of the things that they were discussing in this little news section was, of course, healthcare. That's in the news cycles every day, probably every hour in America, on probably every channel, AM and FM. And they said one of the reasons that the Democrats are blocking any efforts to make changes to our healthcare system in America, which is currently essentially the Affordable Care Act, um, is that they refuse to sign on to anything that has contains the word repeal. Okay, I was thinking about that. So what would a bill have to contain to get me personally to sign off on it if it had the word repeal in it? So I started just playing with it in my head, and I came to realize that the bill would have to contain three words. Three. Universal, single, payer. If it contained universal, single, payer, in that order, right next to each other, I would support repealing the ACA because a universal single payer system would be a superior improvement on the ACA. And that's what we need to do. I actually heard a conservative person, I can't remember if they were a pundit or they were just some minor politician, when discussing the ACA said, you don't drown the duck to get a feather. As in, the ACA needs work, but you don't have to destroy the ACA to achieve that end. All right? I'm a crafter, okay? If you get through a project and discover that half of it is no good, you don't have to throw the other half out. You take that half and you use it to build the next part of your project. That's smart. It's economical. It's logical. It uses reason, which of course is why the GOP base doesn't support any kind of improvement to the ACA. Now, if you break the ACA down into its constituent little bits, most GOP voters will support it. But if you call it the ACA, fewer of them will support it. And if you call it Obamacare, none of them will support it. Now, I don't use that term because I think it's derisive. Also, I think it's inaccurate. If we're going to slap a nickname onto the ACA, we should be calling it Romney Care, which is what it is. It's part of the Mitt Romney plan that was applied in the state of Massachusetts, who still uses that plan, which has been remarkably successful in Massachusetts in making sure people have access to reasonably affordable healthcare. Now, our affordable healthcare through the ACA is not great, but again, you don't throw away the whole thing when some of it needs to be improved upon. And we need to be moving towards a universal single payer system. We are the most powerful nation on earth. All the other industrialized nations have successfully achieved some form of universal health care. Even 45 has talked about how successful Australia has been, and Australia doesn't even have the best system. The best system out there is probably France's. And even the worst of the industrialized nations, Canada, is vastly better than ours. And don't give me the bullshit. Well, Canadians come to the United States. The Canadians come to the United States for some specialized medical treatments. You're correct, they do. But the vast majority of Canadians don't have to. Why? Because they're living in a country that has a healthcare system that works. That a Canadian born in their country never has to worry about going bankrupt because of a medical issue. Never has to worry about being sick and not being able to go to an emergency room or go to a hospital for long-term treatment. Never has to be concerned about that. Not in their whole life. Cradle to grave, they are covered. It is free at the point of delivery, which is what we should be doing. Healthcare is a human right. Healthcare should be part of our system the same way the fire department is, the same way the police departments are, the same way the military is, the Coast Guard, parks, emergency services, all of that should be exactly how we should be handling healthcare. So I'm not talking about enslaving doctors any more than EMS, emergency service personnel, are enslaved. They get paid, some of them quite well, but they're part of the public trust. And that's what we should be doing with healthcare. And we don't in America. We are really happy with letting people go bankrupt. You go look at Europe and find out how many Europeans have gone bankrupt because they got ill. Guess what? None of them have. In America, it is the most common cause of bankruptcy. Someone gets sick through no fault of their own. They can go bankrupt. My friend Amelia is 24. 24 years old. Oh, 25. Sorry about me, Amelia. I don't know if I might get that right. She's suffering through thyroid cancer right now. She didn't ask for that. I didn't ask to be diabetic. It just happened. It's in my genes. I was born with this possibility. I had nothing to do with those genetic codes. No one asked me prior to birth, by the way, would you like the possibility of diabetes? No. Can I pass that on one? Nope, sorry, you can't. Out to shoot. We have the ability to fix this. We just don't, because the moneyed interests are bribing the politicians to make sure that Americans continue to die and they continue to make a profit. No hospital should have a CEO. No hospital should be part of some corporate conglomerate where they've pulled all the hospitals in an entire state together so you don't really have any options whatsoever. Medical procedures should not be as expensive as they are because it's a profit-based business. No American should go bankrupt. Pharmaceutical companies should not be setting prices. We should be setting prices. The people of the United States should be telling, okay, this is how much you're going to charge for drugs, and you don't get to argue. This is not a negotiation. This is what you will charge for drugs, period. Now do your job or get out of the business. We, the people, are more important than profits. So, in closing, I'll sign on to the concept of repealing the Affordable Care Act, so long as the replacement for it has those three little magic words: universal, single payer. Because if they don't, guess what?